It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, thanks for joining us, folks. I'm Sam Lesante. Interesting show for you today. Remember, we're talking about healthcare in the greater Hazleton? Folks, I keep telling you, it just gets better and better and better. Today, I'm very happy to have on the show Dr. Richard Canlas. And welcome to the greater Hazleton area.
Thank you again.
Yeah. I was talking a little bit before the show. Tell us a little bit about you, who you are, where you came from, and it's interesting things we should know about you.
Sure. Actually grew up in Battle Creek from first grade to all the way through high school. And after I did my medical training, my geographic locations have been mostly in Michigan, and I just recently relocated from Appleton, Wisconsin for this position.
Now, when you, I always like to find out, like when you were in high school, did you decide you wanted to be a doctor then, or when did you get the medical field in your mind? Actually,
probably at a young age. My dad was actually a physician. He was an anesthesiologist, or what is known as a gas passer, so to speak. So I saw a lot of the medical through not only him, but his friends and what have you. And so at a very early age, I saw that aspect, and that kind of tweaked my interest. And then the second thing is regarding being an athlete, the two kind of came together, and hence that's where I went into the sports medicine aspect from the medical component, but also being a former and currently recreational athlete at this time.
Now, you have 3 children, right?
Correct.
Yeah. How old are you?
15, Hope. Grace is 13, and my son, Christian, will soon to be 12 in August.
Yeah, so you're in a nice area.
I am.
You're in Eagle Rock. It's
correct.
Beautiful. Well, I know I've been born and raised here. I had a lot of experiences all over the country when I worked with Jack Palance. But how do you find the area?
I like it a lot. Relocating from Appleton, Wisconsin, really big change out there. It's pretty much dairy and flat. Coming out here with the mountains, the hills, the foliage, the green. That's the biggest thing that I see.
And looking at Lehigh Valley, Lehigh Valley Health Network, okay, what attracted you to the Lehigh Valley?
Outstanding organization. You go through any press clipping, research, the system is one of the top-ranked hospitals and organizations, not only in the state of Wisconsin, but nationally.
And that's, I've been saying this for years. I mean, I started the show in 1994, but when we talk about healthcare, I think we're blessed in this area, not because I was born and raised here, but I think we have tremendous medical care here, the doctors, the physicians, the nurses, the licensed practical nurses, what I see have been great. I think second night, we used to do shows in Philadelphia, in the Rothman Institute in Jefferson, and different hospitals, and they're great hospitals, but the doctors there are just as great as doctors here, And I always wondered, what attracts the doctors that come here, okay, versus people say, well, we got to go out of town. Well, there's no reason to go out of town. How do you feel about that?
I totally agree with you. What I have found with this organization, unlike some that I've either talked to colleagues about or where I was formerly, is the biggest difference with this organization is that along with the vision, there's leadership. And with the two together, things get done. Oftentimes at other organizations, you may have one but not the other. Things don't always go that way. I totally agree with you too. What's nice here is I tell people that you have world-class care right here, and you don't have to leave the area to seek that. And I think because of the leadership along with the vision, that's what attracts the medical personnel to this region.
All right, so you saw that vision, okay, before you decided to come here. Okay, now I had mentioned that you're with a team. Now,
correct.
I happen to know your team, and they've been on the show. So how did you, I know you're working with them, so you could say some, well, just between you and I. How do you like working with the team, and who's on your team?
Actually, the team is made up basically of what I would call a musculoskeletal group. We have basically orthopedic surgeons, we have podiatrists, we have primary care sports medicine, myself, we have occupational therapy, physical therapy, physiatry. So basically we have the whole entire musculoskeletal network under one roof. And what's nice about that is if there is a question, we can always curbside, whether it's running down just the hall, whether it's Tiger Techs, etc. So everything's under one roof where you don't have to worry about going cross town to seek another opinion or what have you.
And I think that's fantastic, particularly if you're in like you said, you could curbside service. If you need a question, the doctor's right down the way from you. I always, when people, sports medicine, I guess, how do you define sports medicine?
Yeah, I tell people when you think of sports medicine, a lot of people think just sports. That's not actually what the medical discipline is. It's actually the one medical discipline that focuses on a wellness model versus a disease model. Most other specialties focus on the disease component, where the sports medicine is more on the wellness. So what we're trying to do is promote lifestyle wellness and fitness, and also prevention of illness and injury. The other thing is, it's not just treating the athlete, though we will treat the athlete, be it recreational, organized like at a high school level, or elite level, be it professional athlete. But more importantly, or just as important, we treat the industrial athlete, the work athlete, and we also treat the non-athlete, just the everyday average Joe Jane. The analogy I give, if you think of an overhead activity, a pitcher throwing a baseball, occupational athlete going overhead, or an everyday Joe or Jane reaching overhead to do their daily activities, they're doing the same typical motion, so you can treat not only the athlete, but also the non-athlete and occupational athlete.
So what would be some of the things, so this, when you see, when I think sports, I'm thinking baseball, football,
Correct.
hockey, and that's all it's for. So now this umbrella is pretty big right
Correct.
now. Okay. So now what would be some of the areas, that people who are not in sports that you would be treating for?
Basically, I treat all ages, adolescents, basically school age. I treat young adults, and I treat the senior population. And it basically falls under anything musculoskeletal. So any sprains, which are ligaments, strains, muscle tendons, fractures, or concussions, I see that. So basically upper limb, lower limb, and basically spine.
All right, so we have a large 55-plus audience in northeastern Pennsylvania. How do I know? No, that's a stupid question. But sometimes I have pain, and it's with old age, and not me. I'm not getting old. But I'm just saying, how do I know I should come and see Dr. Canlas?
Typically, there's two avenues where people seek out. I work closely with the orthopedic group, and that's where oftentimes people are confused about who do I seek out. Now, the difference is the orthopedic individuals not only do surgery, but they are trained in the non-operative. That's also what I do. I think it's up to the individual to decide. Oftentimes, the orthopedic surgeons are busy because of surgical schedules or what have you, which would make access a little bit more difficult. Because of that, I can usually get them in quicker, exhaust the non-surgical measures, and hopefully most individuals have a good outcome with the non-surgical measures. But if they fail or continue to have problems despite the non-surgical measures, I can expedite the process and then get them to the orthopedic surgeon to contemplate surgical intervention at that point.
Do you do surgeries?
I do not. I'm a non-operative primary care sports med physician.
All right, so if there's a need, then that's when you would make the recommendation. So
Correct.
What would be some of the typical things that seniors would come in for?
A lot of seniors will come in with arthritic conditions.
Yes.
With that, basically, with the everyday wear and tear, a lot of the joints get affected where there's bony changes and cartilage changes. And so we can treat that medically from my standpoint or with the orthopedic group with either medications, bracing, rehabilitation to restore function and minimize disability.
You know, it's funny, doctor, I find from doing all these shows, and people say, you know, Sam, I didn't realize that I could have resolved this problem I had, and when I saw Dr. So-and-so on the show, I went to see him. For sometimes people get up and say, like I said, oh, it's a part of getting old, but what happens is it gets worse as time goes by. So the first time I'm feeling, you know, aches and pains or whatever, it doesn't hurt to call Dr. Canlas at, you know, Lehigh Valley Health Network and say, look, I'd like to come. Now, do they have to go to their main physician before they come to you?
It depends on insurance. Some insurances require referral, others don't. I always tell people, when in doubt, check it out.
Yeah.
That way, if you do require a referral, the primary care will either initially evaluate you, or oftentimes they'll just basically give the referral without seeing the individual.
Folks, I'm talking to Richard Canlas, not new to medicine, but new to our area. And as I said, you can see we have great health care here. We can take a break. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. Remember, 24/7, SSPTV.com. Watch all of the shows. Download our app. Search SSP TV. And folks, for those of you who are not on cable, or you know people who have the satellite and are on cable, they should be on cable, but download YouTube, search SSP TV, subscribe. You watch all the shows, all the news programs we have, particularly shows like this. I have Dr. Richard Canlas on the show, and joining the Lehigh Valley Physician Group. Information that's important for you. That's the reason, folks, why local television has increased in viewership versus the decline in broadcast and cable network. Not that I'm gloating, but the point is that this is information that's important to you. Rich, thanks once again for coming on the show.
You're welcome.
Now, you said you're non-operative. Okay?
Correct.
All right. So let's get to the things that you would be treating in sports medicine.
Various illnesses and insults or injuries. Basically, I'll see this typical sprains, which are ligament injuries. I'll see the typical strains, which are muscle tendon injuries. I'll see fractures. I'll also see basically mild traumatic brain injuries, i.e., you know, concussions, which is a big thing at this point. So basically, any musculoskeletal condition or injury involving the upper limb, lower limb, spine, and or the brain.
Okay, now you're talking to the biggest baby in the world. Because when I go to Dr. Benyo, my blood pressure goes through the roof. I go for an eye exam, but I mean, like I'm dying. Okay, so taking a person like me out there and saying, if I sprain something, sometime let it go. Maybe, you know, rub it this way or put this on. Okay, sometimes that's not a good thing to do because, you know, you want to self-heal yourself. Okay, how do I know when to call Dr. Canlas at the Lehigh Valley Health and Wellness Center?
I think it depends on the individual and their comfort level with either prior injuries or their apprehension. I always tell people, when in doubt, check it out, because you basically want to make sure that there's not something that could be a red flag. So if you turn your ankle, the question is it just a soft tissue injury or could there be a, you know, fracture? So if there's any type of disability or dysfunction, like you're unable to walk or what have you, that is something to always get checked out. It doesn't hurt to get it checked out, because if it's a, quote, nothing, unquote, there's no harm there. But if it is something is it mild, moderate, severe? And that way we can develop a treatment plan to basically maximize function, minimize disability, and return you to your daily living, sport or work activity, as soon as possible.
What would be a common treatment for, or what would if I sprained my leg or if I fell, etc. What would be a treatment?
Yeah, a lot of times you'll hear people use the acronym RICE, which stands for Rice, Ice, Compression, Elevation. I always like to add a letter called PRICE. Basically, P stands for protection. So oftentimes, if it's a lower leg injury, you may use crutches or a weight-bearing device like a fracture boot or an ankle brace. Once again, you want to rest the area, and that could either be absolute rest, where we shut you down from whatever activity until the area heals, or it could be active rest, or what we call relative rest, where we can actually have you still continue the activity while you either rehab, and it basically facilitates the healing process. We also use ice for the first 48 hours of injury. After 48 hours, you can institute heat. The reason we don't use heat in the first 48 hours is it dilates the blood vessels. That can lead to more swelling. The C in the acronym stands for compression. That's going to help control the swelling, along with the E, elevation. The other thing I'm a real big proponent on is the rehabilitation. We need to get that body part or area back to its normal function, and that can be done either through home rehabilitation program, a training room rehabilitation program if it's at a high school, middle school, elementary school, or through formal physical or occupational therapy, because we want to make sure we treat you not only short-term but long-term. Short-term for the current injury or insult, long-term to prevent re-injury or further injury.
So young children, for example, they're playing or something happens, they fall. And sometimes mothers, are you okay? Well, I have my leg hurts or whatever. Not that you should call the doctor every time something happens, but sometimes, when do you really know, I really should call Dr. Canlas and see, when do I know that, other than, it's only a bruise, etc. I'm trying to say, there's always this fine line. Okay?
Right, and that is difficult to, determine. However, I will say with the example you gave, especially with young kids, I always have the parents or recommend they bring them in. The reason being is at that age, they have what is called growth plates. That is what allows the individual's bones to still grow. Those type of injuries have to be treated either operatively or non-operatively, and without getting that assessed, it could lead to growth plate problems where either malalignment, misalignment, or delayed healing. So those type of injuries, the problem is the kids, their ligaments and tendons are stronger than the bones versus adults where the bone is stronger than the ligaments, tendons. So you always want to make sure with a growth plate injury what type it is, because most of those can be treated non-operatively, but if not, that's where they need surgical intervention to prevent some of the adverse outcomes of those conditions.
Another area that sometimes people have concerns about are concussions. Okay, so how do I know if I had a concussion? You mean you bang your head or you fell, etc. Oh, I have a headache, and take 2 aspirin and I'll feel better in the morning or whatever. Okay, and we had a whole show on this. Okay, but you treat concussions. Okay, how do I know if I have a concussion?
Yeah, a lot of times the concussions, there'll be certain symptoms that you've named off, be it headache or what have you. Oftentimes, though, you can have a concussion without those symptoms. That's what makes this problem a difficult one, is I tell people a concussion is invisible. When you have a head injury, typically one of two things is going to happen. Either it's going to be a structural problem where you can see the damage, skull fracture, brain bleed, etc. The problem with a concussion is it's a non-structural problem. It's basically a functional problem. The analogy I give is if you think of a snow globe, prior to the head injury, everything's nice and settled. When you shake up the snow globe, you've discombobulated the neurometabolic system, and that's what leads to these symptoms. Now, a lot of times it could be headache, others it's just difficulty concentrating. So you can't see that. That's what makes this difficult. One of the things that is out there now are what is called neuropsychological test. Myself, I'm a credentialed consultant for impact testing. That's a concussion test used at various levels, high school, collegiate, and the major sports leagues to assess for a concussion and to also track the recovery of the area. It's made of 4 different parts of the test, and it's testing different portions of the brain to see where you may have injured it. It's not gospel per se, but it's another tool to help us return the individual safely to whatever activity or sport they have.
Now, you brought some interesting things up, okay, like brain bleed, etc. So how long after, if you have an injury or if you hit your head or something, how long, other than saying, well, this will probably go away, let me lay down, which is typical things people say, well, you know, I'm not going to jump to conclusions. However, if you do have a brain bleed or something like that, I would think you want to address that as quickly as you can.
Correct.
Okay.
However, there are some brain bleeds that are latent. By that I mean they delay their presentation. So
would you be able to detect that?
Initially, they may be neurologically fine, but then
Yes,
later on they will develop those symptoms, and it could be fatal, you know, if they're not within
so if I have an injury,
Yep.
can you determine if I come in or bring my child or whatever, a senior, whatever, can you determine that?
We can determine typically through a physical exam the likelihood if there is a structural problem or not, and if we think that is the case, we would then proceed with further imaging like a CT scan or an MRI to see if there is a bleed there.
We come back, I want to talk about delayed pain. You know, for those people who get in accidents, they feel good. Next morning they wake up, oh, I got a problem. Stay with us. Thanks for staying with us, folks. Learning a lot today about healthcare. Dr. Richard Canlas is here. He joins the team, the LVPG team up at the Health and Wellness Center. 501-4LVH. That's 570-501-4LVH. And we're talking about sports medicine, all the great things happening. Remember, download our app, SSP TV. YouTube us, subscribe, SSP TV. So we're talking about delayed pain, okay? Now, typically, if someone's in an accident, you know, they get a hit or whatever, and, you know, they're out, they can walk around, etc. Well, they really don't have any pain considerable. But then the next morning they wake up or whatever, and now we're having, you know, oh, my neck's sore, my back's sore, etc. So here again, if I'm in an accident and I feel that I got a little jarred, should I see Dr. Callus, or should I just wait and see what happens?
Most injuries of that sort typically will heal with what we call tincture of time. The expected outcome is typically resolves with no sequela. The problem is when that basically persists despite the typical treatment plan like the RICE protocol or what have you. We look for situations like what you say, what we call red flags. If there's neurologic problems where there may be numbness, tingling, difficulty lifting things or walking, that type of thing. When you have something that's out of the norm, or if there's disability or dysfunction where you can't perform your typical duty, be it daily living, sport, or work, that's always best to get that checked out, because it could be just a minor condition, but even if it's minor, that can still affect you, and you need a treatment plan to get that back to normal function.
All right, so if I'm in an accident, I would know the degree of if I get really shook up, okay, if they hit me in the rear or the side, and I shook up, but I'm still could walk around, would it be better for me to go and to the emergency room and get checked out, or because I feel okay, but I don't know if something's gonna happen tomorrow, okay? Yep. What do you say? Wait till tomorrow?
I think, depending on the injury, I don't think necessarily, typically with an injury like that, if there's medical personnel on site, they're probably going to send you to the emergency department. If not, I don't think necessarily heading to the emergency department would be the best case. That's a lot of resources used. I would probably follow up either with the primary care physician, the following day to assess if further imaging or treatment options be needed at that time. Keeping it cost containment, not backing up the ER if there's greater need, like a heart attack or that type of thing.
Dr. Richard Canlas, folks, sports medicine now, concussions, ACL injuries, muscle sprains, tears, non-operable. It's always good to get checked out. Comes with tremendous credentials. Check them out. This is one show where you can really know about the physicians. And I must tell you, it's a pleasure meeting you, okay, and I wish you the best. You're with a great team, and you're working with a great team. Please tell my buddies up there in the team I send my best, okay?
I will.
So welcome to the greater Hazleton area.
Thank you very much.
Dr. Richard Canlas, remember, any information you want, the number is very simple, 570-501-4LVH. See you next time.